Jacob's Ladder, pros, cons, advantages, disadvantages. Buy a piercer, episode number 41, coming up right now. For those that are new to the channel, my name is DaVo. I'm a professional body piercer and have been since 1994. I'm the owner and operator of the Axiom Body Piercing Studio, located here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So when I'm talking to you about these things, I'm talking to you at a level of expertise as someone who has done these piercings numerous times and helped people through the healing process. Just a little bit of a disclaimer before we get into this too far. I am going to be talking about a male genital piercing grouping. If you are easily offended or do not want to learn about male genital piercings, then this isn't the video for you. If it isn't age appropriate, I would appreciate it if you didn't watch, though there's not going to be anything here that's going to be sexually graphic or titillating in any way, shape, or form. If you're looking for that type of video, you definitely found the wrong one. The goal of this video is to educate someone who is thinking about getting these piercings done, or maybe their partner, or maybe somebody that's curious about it, having these piercings done by a professional body piercer. So, I guess the next thing to do is describe exactly what a Jacob's Ladder is. The term comes from the Bible, of all places. Jacob's Ladder is a dream that Jacob had, that there was a ladder to heaven. I don't know how that turned into a genital piercing, but that's how it worked. Usually, Jacob's Ladder is usually 3 or more Frenum piercings, though they can be done on the scrotum in the form of rings or scrotum piercings. But usually they start at the top with a traditional Frenum and work their way all the way down to a lorum, which is a low, right there where the scrotum meets the shaft of the penis. With that out of the way, let's get into the pros. First one, number one, is it can increase sensation or change sensation for the person who's wearing the piercings in their partner. As I've always stated in the past, it may not make it better, it probably won't make it worse, but it'll definitely make it different and possibly enhance the sensation that you feel. Number two, this piercing, because it is Frenum piercings, has a long history of healing easily and without issue and fairly quickly, and usually healing out in about 6 to 8 weeks. May require aftercare for about 3 months, but for the most part isn't really a traumatic piercing. Number three, this grouping can be done either on the bottom, side, or the top of the shaft of the penis. It doesn't matter. You're pretty wide open as long as it's going at a 90-degree angle of the shaft. So you have a lot of different options is what I'm getting at. Number four, you can do as many of these as you want if there's room for them. Generally, what I suggest doing is 3 at a time. Once you get past that third one, the inflammation, your pain tolerance, etc., tends to be a bit of a problem for doing additional ones. So usually 3 is kind of the maximum to have healing out at one time. But if you have enough room, you can do 10, 15 of them. Number 5, the last of the pros. This is a piercing or group of piercings that you can have that if you don't want anybody to know that you have them, they don't need to know unless you're specifically involved with them intimately, or they see you at the gym, or you show them or tell them. No one needs to know that you have these piercings. So if you work a professional job, or maybe you live in a conservative part of the world, it's a piercing you can have for yourself and not have to worry about any of the negative side effects that might be caused by people knowing that you have a piercing. So with the pros out of the way, let's move on to the cons and disadvantages. The number one disadvantage, well, the first one, not necessarily the top one, but the first one, is that you cannot exchange bodily fluids on, near, around the piercing for a minimum of 6 months. That doesn't mean you can't have sex for 6 months, but that does mean that you need to use some type of latex barrier. just to be on the safe side, regardless of how long you've been with the partner. The reason for this is that we have an open wound in soft tissue. Even after it's gone through that initial healing phase and it's no longer an open wound, the tissue is very soft and very fragile. So with the activity that's usually involved with interaction sexually, there's a possibility that you could create a situation where there's a slight tear and then you have an exchange of bacteria. So that's why we suggest practicing safe sex for a minimum of 6 months. Number 2, you are more susceptible to STDs even after this piercing is healed. So whenever you switch partners, you need to practice safe sex the way you're supposed to, which you should be doing even if you didn't have genital piercings, which means using some type of latex barrier for a minimum of 6 months until you've both been tested. Number 3, you cannot sleep on the piercing. If you're a stomach sleeper, this might be an issue. It's kind of one of those things where it can be either a pro or a con if you're a back sleeper or a side sleeper, but you definitely do not want to sleep on these piercings while they're healing. Number 4, this is one most people don't want to talk about. You may come across a situation where either for physical reasons or maybe perceived reasons, your partner may not enjoy the idea of you having genital piercings and refuse to interact with you with the jewelry in. So you should be prepared if you are one of those people that switches partners often, that your partner might say, no. You're either taking them out or we're not doing anything beyond what we've already done. So keep that in mind. And then the last one, number 5, can bleed off and on anywhere from up to roughly about 5 days. For that reason, it's a good idea to wear a sanitary napkin or pad, which I'll get in a little bit more when we get into the consultation period part of this, which is next. Now with the pros and cons out of the way, let's go through the consultation. What would I go through and talk to you about if you came into the studio today and said, hey, DaVo, I want to get a Jacob's ladder? First thing I'm going to tell you is that the average healing time is 6 to 8 weeks, but I suggest treating it like a healing piercing for a minimum of 3 months. And that will entail most of the following. The first one being twice daily, submerging the piercing in sterile saline, either using a saline spray such as Nelmed, or mixing it up yourself using distilled water and salt, sea salt preferably. Twice daily for roughly about 5 to 10 minutes. You want to submerge the piercing in that and then rinse under running water afterwards to rinse off all the salt. If you make a mistake or you've caused the area to become contaminated, I'm also going to suggest cleaning off the area with an antimicrobial or germicidal soap, only if you have made a mistake. Cross-contamination prevention. Most of this is common sense stuff. Wash your hands before you handle it. Try to handle it by the ends whenever possible. The only time you have any contact with the piercing is when you are doing the saline soaks or cleaning the piercings. The rest of the time, leave it alone. Sex when comfortable, but you do not want to exchange bodily fluids on, near, around the piercing for a minimum of 6 months, meaning latex barriers. Also, you want to avoid things like spermicide or warming agents or non-water-based lubricants until it is completely healed. All of those things can cause issues. Another thing I generally suggest is staying away from condoms that are extremely tight-fitting. Try to find the ones that are a little bit more loose-fitting to allow room for the jewelry and avoid it shifting back and forth a lot. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with it. Basically, generally what I suggest is putting on a new clean pair of drawers every time you go to bed, just to be on the safe side. And cleaning your sheets on a regular basis. Keep pets away from it. Do not let them sleep in the bed with you. They're just going to drag every nasty thing they came in contact with from that day and then smear it all over your clean linen. Do not submerge piercing in bodies of water you can't control the quality of, which is pretty much everything but your own clean bathtub. So absolutely no swimming until the piercing is completely healed. As I mentioned earlier, they will bleed sometimes, and it varies from person to person. I've had clients where they really didn't notice any bleeding after the first day, but it's a good idea to wear a sanitary napkin, panty liner, or pads for the first week or so, not only to cut down on the embarrassment of staining clothing, but also to add a little bit of cushioning while it's going through its initial tender phase. The other advantage is that it will cut down the amount of moisture in the area, which cuts down the amount of bacteria, which reduces possibility of infection when it's more prone to that first week or so. Now let's talk a little bit about how many you should do in one setting. It's my experience you should do 3 or less. The main reason being is that once you get past that third one, the inflammation starts hitting. It can be difficult to make sure that they line up so they look straight. Also, the marker and everything else is going to get smeared, and you're more apt to have 1, 2 that are perfectly straight, and that third one may be a little off. And if you move on to 4, it's probably definitely going to be off. So, and it really depends on how much pain you can handle. The other thing you want to consider is how much pressure you're putting your immune system through and how healthy you are. The more healthy you are, the more piercings you can heal at one time. But if you have multiple piercings, open wounds on your body for a long period of time, it's going to depreciate that ability and speed. It's going to reduce your body's ability to heal. So, stick around that 3 at a time, let them heal out, then do the second one or third set, second set, etc. Take your time. Your body's not going anywhere, and if you have a reputable piercer, they're not going to go anywhere either. So that's pretty much everything I have to say about Jacob's ladders. I hope you found this video informative. If you did or you enjoyed it, give me a thumbs up. Let me know. If you'd like to see more videos with focus on education on body piercing and tattooing, hit the subscription and then ring the notification bell every time you're notified when we post one of these videos. We usually post about 4 to 5 videos a week. If you feel like I didn't cover something or you have something to add or you have an additional question, please leave a comment. I do answer them when I have time, and other people in the community will do that too if they have the knowledge. So that's kind of the idea here, guys. We're trying to share as much good information as we can. Other than that, thank you for watching. Hope all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a great day, everybody. Go out there, do something exciting, and enjoy yourself.